The amount and consistency of these secretions varies for each individual. Now, during the menstrual cycle itself, there is a change in the secretions. Prior to ovulation, the consistency of the secretion is thick and dry. At the time of ovulation, there may be a little increase in the secretions, and post-ovulation, the secretions become thinner and more sticky, which allows the sperms to move up in the women in the reproductive age group. When you have an increased discharge, when there is smell, when there is itchiness, you will invariably consult your doctor. She will examine you and see what is the kind of discharge. If it is a curdy discharge, it indicates a yeast infection. If it is a yellowish green discharge, it means it's a trichomonas infection. If there is a greyish white discharge with a fishy odor, it means bacterial vaginosis. Sexually transmitted infections can also bring in a lot of discharge, which may be mixed in nature, associated with rashes and blisters. So the right medications will take care of all these infections. So normally the vaginal discharge is something which is there for all women. Only if it gets infected will you have problems, and then you need to consult your doctor to get the relevant treatment. I'm Dr. Rita Singh. The vaginal discharge is a normal mucus secretion from the cervix and the vagina that protects the vagina by maintaining a good pH, keeping it moist and lubricated, and prevents infections. It is a natural secretion from the female reproductive tract. It begins at puberty under the effect of hormones and changes over the years as well as different times of the menstrual cycle. The amount and consistency of these secretions varies for each individual. Now, during the menstrual cycle itself, there is a change in the secretions. Prior to ovulation, the consistency of the secretion is thick and dry. At the time of ovulation, there may be a little increase in the secretions, and post-ovulation, the secretions become thinner and more sticky, which allows the sperms to move up in the women in the reproductive age group. During the menstruation, the discharge is a bleeding, and towards the end of menstruation, blood-stained watery discharge. During pregnancy, there is always a tendency for increased vaginal discharge. Now, this is under the effect of pregnancy hormones as well as an increased blood flow into the pelvic area. This is completely normal, and only the hygiene has to be taken care of so that when there is an increased discharge, you keep that area clean and dry, no infections will come in. As the woman reaches menopause, the effect of estrogen starts going down, and therefore the vaginal secretions decrease. There is a tendency for vaginal dryness and irritation during menopause. Now, this is the secretions in a normal phase, different phases of a woman's life. If these secretions increase in amount or in color and have smell, if they are associated with itching or burning sensation in the vaginal area, then it may indicate that the normal secretions have become infected. The vagina rather has healthy lactobacilli. When this gets depleted by other bacteria or by other fungal infections, then the infections have come in. So depending on the type of discharge, we can actually define what is the type of infection. When you have an increased discharge, when there is smell, when there is itchiness, you will invariably consult your doctor. She will examine you and see what is the kind of discharge. If it is a curdy discharge, it indicates a yeast infection. If it is a yellowish green discharge, it means it's a trichomonas infection. If there is a greyish white discharge with a fishy odor, it means bacterial vaginosis. Sexually transmitted infections can also bring in a lot of discharge, which may be mixed in nature, associated with rashes and blisters. For the yeast infection, we step in with the antifungal medications. And for the trichomonas, bacterial, and the STIs, we step in with the antibiotics. So that takes care of the unhealthy vaginal discharge. Eating a good diet, having plenty of fluids, having exercises in your routine, wearing good, comfortable clothes, keeping the local hygiene good all the time. And if you have a tendency of increased discharge, which is normal, a frequent change of undergarments will ensure that the local hygiene is taken care of. So normally the vaginal discharge is something which is there for all women. Only if it gets infected will you have problems, and then you need to consult your doctor to get the relevant treatment.